Hello everybody. Today I'm going to talk about a case of bilateral otitis media with effusion. So this gentleman presented with symptoms of ear pain, pressure, hearing loss, fullness in the ears and balance problems. And they did not improve with medicines. So I subjected the patient to myringotomy and bilateral grommet insertion. This is done to remove the fluid from the middle ear so that the patient's symptoms of fullness, popping sound in the ear, especially during swallowing, all these complaints can be resolved when they don't respond to medical treatment. So this was a 36-year-old male who complained of this because he had fluid in the middle ear. So there was a popping sound in the ear and bilateral ear blockade, also some pain. This was following an episode of cold, and it did not resolve with course of antibiotics, antihistamines, nasal decongestants, and topical antibiotics in the ear. So I did an audiogram, and the audiogram showed 30 to 35 decibel conductive hearing loss in both the ears, indicating that there was some kind of a hearing loss. And the tympanometry showed, impedance audiometry showed a B type of audiogram, which indicated that there was fluid in the middle ear. So this was even after using a course of medicines, and since there was no improvement, I decided to take the case up for bilateral myringotomy and grommet insertion. So I did the procedure under local anesthesia. As you can see that I'm infiltrating the ear external auditory canal with 2% xylocaine with adrenaline solution in 4 quadrants at the junction of the bony and cartilaginous canal. And once the ear is anesthetized, I'm visualizing the tympanic membrane with 0° 4 mm endoscope. So this is an endoscopic endomyringotomy which I'm doing using the myringotome knife. I'm making an incision in the tympanic membrane in the anterior inferior quadrant. You can see serous fluid coming out of the incision as soon as I'm making it. So the middle ear, which was filled with this fluid, is now being decompressed. I'm using a suction tip, fine suction tip, to take out all the serous fluid through the myringotomy incision. So all the fluid has been removed. Now I'm placing a grommet, that is a ventilation tube, through the myringotomy incision, and I'm placing it in the tympanic membrane, half of it inside and half outside. And there is a central opening in the grommet through which any remaining fluid which may be there in the middle ear will come out, and the patient will be relieved of the symptoms of ear blockade, popping sound in the ear pain and fullness, and will be able to hear better within a week, 10 days time. So here I've gently manipulated and placed the grommet in the right ear. I have repeated the procedure in the left ear also. This grommet will come out by itself within 3 to 4 months time, and the incision which I have made in the tympanic membrane will heal nicely without any problem, and the patient will have a very good hearing outcome. Sucking out any fluid which may be there through the opening in the grommet and ensuring that the grommet is in place. So that is the grommet which is placed. There is a ventilation tube. There are 2 types, the shepherd and the Shah type. Checking once more. So this is how I do it, using the 0° endoscope and the endocamera system by visualizing on the monitor. I have done this procedure of endomyringotomy with grommet insertion. So this is a good procedure to relieve patients who complain of ear pain, blockage after a bout of cold, and those who don't respond to medication. Thank you for watching.